Hello, everybody. This is Gary. Today is February 13th, 2022. It's 5:56 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Um, Today I'm doing pretty good. I pretty much stuck to my daily schedule today. I did my physical therapy exercises. I exercised on my exercise bike. I went to the pharmacy to pick up a prescription. Um, did some work on my computer. Making this video as part of my daily schedule. I did some early morning meditation. And I'm going to do some meditation after I'm done doing this video, this live stream. My symptoms are pretty much under good control right now. My depression's not that bad. My anxiety is not that bad. My delusions aren't as bad as they were 2 or 3 days ago. My paranoia got really bad 2 or 3 days ago. I thought somebody broke into my apartment and rearranged my stuff without stealing anything just to drive me crazy. I have no actual evidence that happened. I'm assuming it's part of my paranoid delusions, and it's less intense today than it was 2 or 3 days ago. Um, Tomorrow, I have an appointment with my physical therapist. Over the past 5, 6 weeks, I've been having a lot of muscular, skeletal, and nerve pain. I'm on my 6th day, I believe, of using the drug Cymbalta for the pain. It's going to actually take time before it starts to work to do anything for the pain. It may take several weeks. Cymbalta is an antidepressant, so it may even help with my anxiety and depression over time. But I'm also taking Neurontin for the pain, Tylenol for the joint and arthritis pain, and I'm taking Flexeril as a muscle relaxant to help with any muscle spasms and pain from muscle spasms. Um, I obviously do have arthritis, so that's definitely part of the pain that I'm experiencing. I am getting older. I'm 56. I'm not 18 years old anymore. Physical pain comes with getting older. But as for the other causes of my physical pain, I don't have a diagnosis. Um, so right now we're just sticking to the medications that I'm on, waiting to see how they work, and I'm continuing my daily physical therapy. And I have a physical therapist appointment tomorrow. We're going to start concentrating on working on my upper body. For the past couple of weeks, I've been working on my lower body for physical therapy. Um, but on Tuesday, I have a group therapy session coming up, which is once a week, every Tuesday for 10 weeks. I believe this is the third or fourth week that I'll be attending this group. On Wednesday, I believe I have an appointment with my psychotherapist. And in about 5 weeks, I have an appointment with my psychiatrist. I just saw my psychiatrist, I believe it was last week. Um, so my hallucinations aren't that bad right now. They're pretty much at minimum baseline. My depression and anxiety is not too bad. My delusions and paranoia are not that bad. I did go out today. I didn't feel like anyone was following me or anything like that, or spying on me, which is a feeling I often get when I'm walking around outside or taking the bus somewhere. I take the bus to everywhere I go because I don't drive. And if I have a medical appointment where the buses don't go to, I will take a Medicaid cab to get to my appointments, which is what I'll be doing tomorrow to get to my physical therapist tomorrow. Um, I am able to get to my psychotherapist by bus because the buses do happen to run out to my mental health clinic that I attend. I only use a Medicaid cab when the medical office I'm going to is out in the suburbs and the buses don't run out that direction. Um, like my cardiologist a urologist, a physical therapist. And I also have an orthopedic consultation coming up because I have my hip and my spine. But I also have bone spurs in my lower spine in my left and right knee. So I'm going to be consulting with an orthopedic surgeon. I really doubt that I'll need surgery of any kind that's orthopedic, but I am going to the consultation just to make sure, to see if there's anything that needs to be done about my bone spurs. Bone spurs are when extra bone forms in the joints that aren't supposed to be there. And I have them in my knees and my lower spine, along with arthritis. Um, but other than that, there's not much else to report on. Um, I'm just trying to stick to my daily schedule and live my daily life. That's all for now.